Hi everyone, my name is Wani Li. This is my real SIA analysis of COVID-19 in poverty area in China. The full title of the report is Economic Impact Assessment of the COVID-19 Pandemic in 5 Poverty Counties in China. It is conducted by the China International Center for Economic Technical Exchange and the United Nations Development Programming, working together with a number of UN agencies. The assessment is aimed at gaining insight into the economic and social impact of the pandemic on poor areas and vulnerable groups who live in those areas. The first-hand data and information gathered in this assessment can inform the design of UN projects in the near future, as well as inform local government decision-making to better address the social-economic impact of COVID-19. So as you could see in the title, this is kind of a special essay report because it is not an assessment of any particular project or policy, but rather an investigation and analysis of the impact of the COVID-19. So it is not a standard SIA report, but I think it's interesting and worth paying attention to, especially as the outbreak continues. Let's take a look at the background of this report. According to the Sustainable Development Report 2020 by 2019, the world has not on track to achieve the Sustainable Development Goals, as COVID-19 has brought even more challenges in SDGs attainment. Over the past 40 years, China has lifted 700 million people out of poverty and is committed to lifting more people out of poverty. The COVID-19 outbreak has made poverty alleviation more difficult, and poor areas are facing higher economic, social, and health risks. Many people have lost their livelihoods and income during the pandemic, which is also likely to push those who have recently been lifted out back into poverty. So there will be more pressure on poverty alleviation resources and lower employment rates. In response to the outbreak, China imposed mandatory lockdown measures to reduce the spread of the virus. The research period for the report began in June 2020, when China has temporarily controlled the pandemic and gradually resumed economic and social activities across the country, which created conditions for this field investigation. The assessment selected 5 poverty counties in different provinces, which are Zhouqu, Neixiang, Zhangwan, Yilong, and Chengbu. These counties are located in central of China, and most of them are mainly agriculture counties which have been greatly affected by the pandemic. The information used for analysis in this assessment was collected through 2 main methods: the household survey and the survey of village or community officials to understand the impact of COVID-19 at both individual and community level, and workshop discussions with county officials to understand the impact on their communities. The surveys were conducted through face-to-face interviews by trained enumerators. Workshops took the form of discussion with representatives from relevant departments of local governments. They were carried out either through individual discussions or group discussions with relevant departments. The discussions were conducted in an open manner according to a prepared outline. 3 rural villages and 3 urban communities were selected in each county as survey sites to understand the different impacts of COVID-19 across different groups. The assessment included specific analysis on poor households, older people, women, children, along with persons with disabilities, migrant workers, and ethnic minorities. These groups are more likely to experience greater vulnerabilities during the pandemic due to their disadvantaged socio-economic position pre-pandemic. And there is one thing need to be noted: due to the time and funding limitations along with the practical challenges, this assessment did not adopt probability sampling during the sample selection. So these are the specific selection principles for the sample households. You could pause the video and read it if you want. Next, I would like to briefly talk about the 3 main research aspects of the assessment. First is the impact on household income, expenditure, and employment. So the report is focusing on the fourth section under this category: impact on those in wage employment, impact on non-farming self-employment, impact on smallholder farmers and their agriculture production, and impact on household expenditure and income. So basically, most of the small and micro-sized enterprises and self-employed business, the main source of employment are in these areas, and they have ceased production during pandemic, which result in more unemployment. Various tax reduction and exemption policies, which aim to help companies resume work and overcome difficulties, have significantly reduced local physical revenues. I think there's one interesting point is the rural smallholder farmers in these areas were not as affected as those relying on off-farm incomes. This is partially because the main lockdown occurred before the spring agriculture season in these areas. Only 33% of farming families sell their products to the markets. So the majority of the product was for their own consumption, so there's less impact by reduced access to the market during lockdown. And households who were eligible for social assistance transfer were sheltered from the worst economic shocks of COVID-19, and those who were not eligible but still relatively low income were the worst affected. And the working time and incomes of informal sector employees fell far more sharply than those of formal sector employees. So you could see the COVID-19 did has a serious impact on the economic on those poor areas, especially the family who have low incomes. The second aspect of the report is the impact on children. So they look at the caregiving, education, physical impact, and children discipline during the COVID-19. Due to the lockdown policy, all the schools are having online classes, and all these surveyed areas were established the online learning, but the local authorities reported the difficulties in maintaining the quality of standards of online classes due to the unfamiliarity of teachers with this kind of form of pedagogy. There's not every family who have the condition to have their children have the online classes. This kind of form of teaching doesn't work really well in the rural areas. And during the lockdown, children are benefit from having more time get along with their parents. But there's also 26% of children under 8 years old who normally attend school were left unattended for an hour or longer every day during school closures. And this has mainly happened in rural and poor households. Third, it analyzed the impact on health services, older people and women. About one-fifth of the respondents reported difficulty in obtaining necessary daily care, financial assistance, and emotional companionship, especially for older people who live in urban communities. Older women receive much less assistance in household activities than older men. During the lockdown, about one-third of pregnant and lactating women did not receive timely medical care. Persons with disabilities are more negatively affected in terms of access to medicine and health services. Although local governments and community assistance for those people has helped to alleviate some of these challenges, the healthcare in these poor areas remains systematically flawed, with weak equipment, inadequate technical professionals, strained facilities, and inadequate services capacity. These shortcomings have become even more acute during the pandemic. Overall, in response to the pandemic, the China government took compulsory pandemic prevention measures, and the COVID-19 is inevitably has a serious impact on these five poverty-stricken areas, with difficulties in enterprises resuming work, increased unemployment rate, and rising fiscal pressure. The COVID-19 has exposed areas that need to be improved and not significantly disrupted access to social services due to the positive role of poverty alleviation systems and community organizations. And also under the leadership of poverty alleviation system and the local governments, which greatly elevated the health impact of the pandemic on the poverty areas. More efforts are needed to protect vulnerable groups in poverty-affected regions to ensure their resilience in post-COVID-19 future. So now let's look at the analysis critique of this report. For the data collection, I think the social impact assessment variables involved in this report are comprehensive. The survey mainly focuses on different types of vulnerable groups. The household survey mainly analyzes the family members' employment and wages, self-management, agriculture production, family income and expenditure, children's education, understanding of government measures and policies, as well as the social problems of vulnerable groups affected by pandemic. The community survey investigated in the population of each county, the local employment, the enterprises production, agriculture production, as well as the prevention and control measures and policies of each county. In general, the services that each question and research direction involve 5 aspects of social impact assessment variables. All research data come from services and workshop discussions. Local residents and governments can provide real and effective data information, so the public participation of this report is sufficient. This assessment is not based on a project or policy, so there is not a standard public scoping process. Due to the limitation of the survey and the lack of randomness of sampling, data of all residents may not be collected, and even the bias may occur. While the study sample involved different types of families and communities, the results may not be statistically representative, and its conclusion may not be generalizable to the wider population and community. And there is no comparative study or mitigation or monitoring strategy in this report because it is not based on any project or policy. In the case of this report, I think it is consistent with the international principle of SIA as considering its purpose and goal, but I also believe there are some issues with this report. For example, it is not based on a project or policy, so it doesn't have any specific solutions or alternatives to the outbreak. And the assessment may not be fully representative in China or over the world, but it is still a very useful information for assessing the socio-economic impact of the outbreak. So the analysis of the impact on these poor areas and vulnerable groups mainly just only involve the social and economic impacts, while the environmental impact assessment is kind of losing here, but it can still inform the follow-up plans and policies in their SIA process to further promote the environmental and sustainable development. That's all for my presentation. Thank you for watching.